I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue, and I'm a private practicing OBGYN. Now today we're going to be talking about some sensitive adult topics. So if you wanted to get your kids kind of busy in a different part of the house, I think this is a good topic that we're going to talk about today. It's part of our men's health segment. And my husband was like, if we start saying there's some adult topics, we're going to get lots of views.
Today we're going to talk about low T. That seems to be in the press a lot. You know, it's not always has to be treated, even if you have a mildly low testosterone level. So for example, if you have a 40-year-old gentleman who's obese, has a borderline low testosterone, and his endocrinologist has ruled out all the other factors that could be causing it, you wouldn't automatically jump to treating this person with testosterone. Really, the way to attack this problem is with lifestyle changes, making sure they have an ideal body weight, they exercise 150 minutes a week, they have a good diet, some suggestions for supplements that might help them, so you don't automatically jump to testosterone. The important thing with low testosterone is not to look at it just as a disease, because we men have a decrease in testosterone about 1 to 2% every year after 30 years old. So it's a natural thing, and so the question is, do you treat a low blood value without any other symptoms or just mild symptoms? And that brings up the topic of what is called hypogonadism. We're going to put this up on a slide.
I think that's a good point, because whenever I do my hormone replacement with women, we don't want to treat the lab values. We really need to look at the person and how they're feeling. With men, what I was taught was that you want to know why they're coming to you to see for treatment, because are they now 60 years old and wanting to have a baby because they have a second marriage with a 30-some-year-old woman, or are they wanting to get their stamina back up or their energy?
Exactly, and that's, if someone comes in, you have to ask them, why do you need it? If it's just because they have low libido or erectile dysfunction, it has to be in constellation with some other things. So if they come in and they're having muscle weakness, fatigue, depression, lack of self-confidence, those are signs of not just low testosterone, but that's a syndrome that's called hypogonadism. Low testosterone is just part of the picture. You have to be able to address each one. Typically, when someone comes in with those type of symptoms, your physician is probably going to have to run some tests, not just your testosterone, which, by the way, should be done in the morning and should be measured on more than one occasion, but they're going to also check into your blood lipid profile, your prostate-specific antigen.
I think that's actually easy to remember for men. Most men's sex drive is highest in the morning. Most women, well, I'm not a morning person. I prefer to have sex at night. But I know his sex drive is higher in the morning. No, it's important. It's important.
Everybody knows that.
No, but even in Cosmopolitan magazine, they said most men prefer to have sex in the morning. So that's going to be easy for y'all to remember. If you ever have a test order for testosterone, you have to have it done in the morning.
So let's say if you do have someone with low testosterone and they do choose to start the supplement, it really should be monitored. Monitoring consists of not just the testosterone level, but the PSA, as well as some of the blood values, because those things get affected. And at the onset, at the beginning of the treatment, they should be monitored like every first 1 or 2 months, then 3 months, and 6 months, then 12 months, and then after they're stabilized, at least once a year, to make sure that you are on the right path.
Okay, you guys, do you think that testosterone treatment causes prostate cancer?
Well, most of the evidence shows that it doesn't do that, but the reason it does not do that, although there's a theoretical consideration, because the more testosterone is in the body, the more it helps the prostate cancer grow. Most of the time we check the PSAs when you're monitoring testosterone is because you want to make sure you pick up a prostate cancer. If it happens to come up during the testosterone supplementation, then it should be stopped.
Yeah.
side effects that can occur with taking testosterone, and they include sleep apnea. There's an increased risk of that developing. It also affects some of the blood values that you have in your system, that those need to be monitored, such as the hematocrit. Causes testicular atrophy. Not many men know this, and infertility as well. So what they call cardiac events that have occurred in one study where they were treating men over 65 years old, and they actually stopped the study because of the risk of heart problems with these men. In addition to those risks that I mentioned before, one of the others is benign prostatic hypertrophy. In other words, the prostate gland itself can get larger, and that's why during the initial examination, physicians should be doing what is called the digital rectal examination, checking the size of the prostate, making sure it's not too big or too large to begin with, because that can actually cause major issues down the road.
So if you don't want to do testosterone, what are the other options?
Yep. So really is lifestyle changes. Ideal body weight. Obesity actually has been shown to be a factor that actually decreases testosterone. So really should try to get the patient on a exercise program and a reasonable diet. We're big fans of a Mediterranean diet, which actually decreases your risk of cancers, heart disease, and other issues as well. So we want what's called an anti-inflammatory diet. And in terms of exercise, most of the studies point to at least performing 150 minutes per week. That's 150. And there are some supplements that have been purported to be effective as well. Panax ginseng is, and we'll put these on as a slide. There have been some others called maca, M-A-C-A, something called a horny goat weed, which actually doesn't increase testosterone at all, but actually is more effective in animal studies and erectile dysfunction.
I want to know why they call it horny goat
I don't
weed.
either. Some of the other supplements include vitamin D, because there have been good studies that show low vitamin D levels are associated with low testosterone as well. So it's, again, this is going back to what I spoke to at the beginning when the man comes in and they have a low testosterone or low T. Other things really have to be taken into consideration as well. We're going to get into the subject of erectile dysfunction. So if you're have a male who's actually has erectile dysfunction, you don't just look at those things that I mentioned, but in addition, you also look at mind-body techniques as well, because depression and some psychiatric issues can also affect erectile dysfunction that are independent of low testosterone.
It's really important to talk about what our patients do for a living. Heavy metal contamination through our skin, welders, different factory workers, they can have all these heavy metals that do affect testosterone levels. So it's important to tell your doctor what you do for work.
Molybdenum is one of the metals that have been involved in low testosterone levels. And there's another chemical called phthalate, which we will put up on a slide as environmental factors that need to be considered as well. And those have been associated with low testosterone, so you could substitute low testosterone in a man and still not get the levels to rise up because they're exposed to these toxins. The other things that, to talk about with erectile dysfunction, not just the lifestyle changes, but there's also a lot of medications that are out there that can cause erectile dysfunction and that are independent of low testosterone. They include anti-anxiety medications. Some of the antidepressants will do that. Narcotics are notorious for causing erectile dysfunction. Excessive alcohol use. So these are all things that need to be considered as well.
I like that you talked about mind-body medicine. Mind-body medicine actually is proven in data to increase testosterone levels. One of the most interesting ones was a pose called the power strike pose. And it's just standing very tall with the hands at the hips and chest up. And that's very common in yoga.
So again, recapping, lifestyle changes, mind-body is one of those things that can be done. Some of the first-line medications include Viagra, Cialis, Levitra. Those are very effective, and I think in about, last statistic I read is about a third of the men don't respond to that. So other things you can do, horny goat weed is one of the ones we talked about. It's traditional Chinese medicine. They call ashwagandha, increases testosterone, but supposedly that helps. Some of the beetroot juice is one of those that releases what's called nitric oxide, which increases the circulation, that helps with erectile dysfunction.
He brought up ashwagandha, which is an adaptogenic herb. An adaptogenic herb is very, very important. It's an herb that's not mood altering, but it actually helps us to adapt to stress. And we get into a subject called adrenal fatigue syndrome in both males and females. And what happens during a typical day is that our adrenal gland makes cortisol. The cortisol is the highest upon waking in the morning. By noon, it decreases a little bit. By afternoon, it decreases a little. And by bedtime, we've done our jobs for the day, so it's at the low. And that allows us to sleep through the night, rest, and then the next morning make a high amount of cortisol again. But for some people who've had either a very traumatic experience or ongoing stressors, their adrenal gland is having to produce cortisol at more levels than usual, which they can sustain for a while. Then they develop what's called, it used to be called adrenal fatigue syndrome, and it is reversible, and it's with things like adaptogens, which help your body to make cortisol so that your adrenal gland isn't working so hard. Whenever people do this, it's really important, like he said, to use mind-body techniques to learn how to decrease cortisol. Whatever they can do to decrease stress will help that adrenal fatigue reverse. Then they're able to make the right amount of their own testosterone.
There are some botanicals that have been shown to help with erectile dysfunction. As I mentioned, Panax ginseng was to help with increasing testosterone, but carnitine, pycnogenol, arginine are a few that have been out there and have been shown some success with erections.
I think it's really important to address in a relationship, and as we age, sex becomes different. It's very important for you both as a couple to really talk. Sex is a very intimate thing that can be done without a penis in the vagina. Actually, Dad, who is also a practicing gynecologist, OBGYN, for 45 years, he used to tell his patients, "Isn't it nice? Now you guys are making love, not having sex." So it's important, if you see your husband or partner having erectile dysfunction, talk about it. Be together intimately, because men, their goal during sex is to please their partner. They feel they're a man when they please the partner. There's lots of ways to please the partner if there's erectile dysfunction. And so you keep the relationship solid and intimate. So it's just part of aging and developing that relationship, and you go through all these changes together.
Mm-hmm. Some other techniques for erectile dysfunction that I forgot to mention are these. You have these suction devices that put a constriction around your penis, and you have to avoid these if you're on a blood thinner. These I've read as it seems to be somewhat effective. I do need to mention something about how we deliver testosterone. Forms of delivering testosterone include what is called a transdermal, which is either like a paste, a gel, or a patch or a cream that you can put on the skin. You really shouldn't be using any oral forms for testosterone replacement. There's also a pellet that's out there. It can also be given as an intramuscular injection. The key point to this is really that it should be monitored throughout the process. Otherwise, you can either give too much or not be giving enough. But one last thing I need to talk about. All the drugs that I mentioned before, Levitra, Viagra, and Cialis, those help with erection, but they don't help with libido. Testosterone is more of a replacement that will help with both. And testosterone really isn't always the first line treatment when men have erectile dysfunction. All right, thank you very much for joining us today.
What's the next topic?
Next week, we're going to be continuing the men's health segment, and we're going to be talking about prostate cancer. All right, goodbye, everybody.
We'll see you next time on our next video.